Hi, welcome to Tony's tutorial, and today I am so happy to tell you that we are going to make a new step in our path forward. Yes, I am going to bring forward an exclusive module for biomechanics for various competitive examinations, whether it is MOH, DHA, PROMETRIC, PSC or central government examination or even an interview. I have heard often people telling biomechanics is tough, I cannot find out the answers from the textbook. And here we have done an exclusive, extensive research work for you so that we picked up top 50 questions from each biomechanics chapter. And I'm bringing forward as 25 questions per module and 25 questions in next module. So in this module, we are going to see top 25 questions from hip complex biomechanics. And I would request you to take a pen and paper and write down the answers once the questions are brought forward. But at the same time, after that, we will have the correct answers and a small description about the answers. This description will help you to memorize the chapter in a nutshell. And even if you are attending 25 questions, by this description at the end, you will master the chapter as it is. So let us have a look at the top 25 questions from hip complex biomechanics. This is Tony's tutorial. Here we go on to the top 25 questions on hip biomechanics by Tony's tutorial. And here we will be discussing top 25 questions from first part of the up to the half of the hip complex biomechanics chapter, and in the next video we will be discussing the rest of the 25 questions, and in total 50 questions we will be able to master the hip complex biomechanics. I'm pretty sure about that. And I have arranged the slides I have arranged the video in such a way that you get a maximum about 20 to 30 seconds per question. If you want more time to attend the question as per your particular competitive exam, you can pause the video and take your own time. There is no issues with that. And here we will have a general time of 20 to 30 seconds per question. As per the depth and the difficulty of the question, I have arranged the time schedule. Let us move on to the questions. Congrats, you have completed 25 questions successfully, and I believe that all of you get 25 out of 25. But let us see the answers, and along with the answers a brief description, because I have included here a brief description so that the time that you spend with this video is actually worthwhile. So by the end of this video you actually get not just 25 questions but a brief idea about the chapter itself, the half of the chapter itself. So that's my intention, and let us move to discuss the answers. First question is alternate name of the hip joint, and the correct answer is option D, 1 and 2, that is femoroacetabular. It is known as the femoroacetabular or coxofemoral joint. And the term capitofemoral is incorrect because capita refers to the femur and femora refers to the femur. For your information, I have tried to include a small picture of the hip joint where you can see the femoral head, the capsule, the synovial layer, etc., synovial layer covering, etc. And to the second question, what portion of the acetabulum is formed by ischium? The correct answer is 2 by 5. Just see the diagram where we have shaded with the different colors. Each color denotes the part of acetabulum formed. The first one is ilium, which forms 2 by 5. Ischium also forms 2 by 5, and pubis only forms 1 by 5. So if it is a total 5 portion, 2 by 5 by the ilium, 2 by 5 by the ischium, and 1 by 5 by the pubis. That is how it is distributed. And the next question, ligament that spans the gap between acetabular nodes. And see the acetabular nodes, the lower one is the acetabular nodes, and acetabular nodes is actually covered by a ligament. That ligament is known as the transverse acetabular ligament. Only thing that would confuse is the ligament teres, but it is attached to the head of the femur. This is a transverse ligament and transversely runs and covers the gap between the acetabular nodes. See, that is shown in the diagram. Which of the following is not correct statement regarding ligament teres? Ligament teres is known as ligament of the head of the femur. That is correct answer. Ligament teres is known as round ligament. That is the other name of the ligament teres. Remember that. Ligament teres is intracapsular. That is also correct. And ligament teres is intrasynovial. That is the wrong answer here, because even though it is inside the joint cavity, we may feel it as a synovial, but intrasynovial, but it is not intrasynovial because synovial membrane covers it. And next one is the ligament of bigelow. That answer is Illiofemoral ligament. That is the strongest ligament in the hip and one of the strongest ligament in the human body. The pubofemoral ligament, ischiofemoral ligament are also capsular ligament. And about the transverse acetabular ligament, we already saw it is actually covering the gap between the acetabular nodes. That is an easy question to answer. And the next question is the capsular ligament of the hip joint, and the correct answer, which is not a capsular ligament. The question is a bit tricky. It is which is not a capsular ligament. That is a round ligament, because round ligament is ligamentum teres. All other ligaments, iliofemoral, ischiofemoral, and pubofemoral, are the capsular ligaments of the hip complex. So if someone asks you in the exam which are identify the capsular ligament, the correct answer is you can pick up like iliofemoral, ischiofemoral, and pubofemoral are the capsular ligament. See the diagram. Identify the correct statement regarding the orientation of femoral head. This is a tricky question and sometimes you may forget it, but the femoral head is oriented medially. You know that it is facing medially. Superiorly, yes, it is superior, not inferior, you can imagine, and anteriorly. That is why we say that femoral head is slightly anteverted. Our femoral head is slightly having an anteversion of 15 to 20 degree, and that is normal anteversion. So the femoral head is arranged medially, superiorly, and anteriorly. What is the normal angle of inclination of the femur? The correct answer is 125 degree. And how it can be useful for you is you can imagine, just see the diagram. Coxa vara is decrease in angle of inclination. If it is getting decreased, then that result in the condition known as coxa vara. If the angle of inclination is greater than 125 degree or 130 degree, that is actually producing a clinical condition known as coxa valga. So coxa vara and coxa valga is related to angle of inclination of the femur. Which of the following is correct regarding angle of inclination? Can vary between 110 to 144 degree. That is correct. Even though it is 125, it can vary between 110 to 144 degree. It is smaller in females. That is correct. Angle is same between side to side of an engine. That is the incorrect thing, because from between right to left side, the angle of inclination will be different. but angle of torsion will be same between right to left side. Remember that angle of torsion is same, angle of inclination is different. Angle of inclination at birth is approximately, that is thing to remember, it is 150 degree, and that was the last point we discussed. It will decrease after skeletal maturity, to the skeletal maturity. From birth to skeletal maturity, angle of inclination decrease. In birth, angle of inclination is actually a greater value, 150 degree. The normal value of angle of inclination is 125 degree, and it can vary between 110 to 144 degree. Which of the following is true regarding hip joint capsule? It contributes substantially to the stability of the joint. Very correct. It has 3 capsular ligaments. We saw pubofemoral, ischiofemoral and illiofemoral. It is weak postero-inferiorly. Very correct. And strong antero-inferiorly. That is the exact thing. Hip joint capsule is very strong antero-superiorly. Anteriorly it is strong. So all of the statements are correct regarding the hip joint capsule. Just remember the points about the hip joint capsule that may be asked. Specialized structure formed by hip joint capsule at the neck of the femur. That is a very important question in this chapter. That is zona orbicularis. See, the zona orbicularis is seen in the diagram. It is like a collar. It is a collar in the neck of the femur that is formed by the hip joint capsule, and that structure is known as zona orbicularis. What is the function? The function is that it prevents the dragging or displacement of the head of the femur. If you have any clarity, you can refer to my videos in my YouTube channel for more clarity. Which of the following is true regarding the capsule of hip joint? Femoral neck is intracapsular, greater trochanter is extracapsular, lesser trochanter is intracapsular. The correct answer is option D, A and B. It is because lesser trochanter is not intracapsular. Actually, lesser and greater trochanter is extracapsular. They are seen outside the capsule. Only femoral neck is intracapsular. So remember, the capsule do not cover greater and lesser trochanter. The fibers that runs deep in the hip joint capsule and that helps in the transmission of blood to the head is known as the reticular fibers. So they are actually arrangement or differentiation of the hip joint capsule. Especially it is a differentiation of hip joint capsule. These fibers are known as the reticular fibers. Capsule is made up of oblique and longitudinal fibers. These oblique fibers actually modifies into forms the reticular fibers, which actually transmit the blood vessels to the head and neck of the femur. The value of angle of torsion in females, that is 18 degrees. So the angle of torsion in females is 18 degree. The other questions that can be asked about the angle of torsion is, what is anteversion? See, the anteversion of the femur, 15 to 20 degrees normal angle of torsion. Then you have increased angle known as femoral anteversion. Then you have decreased angulation known as femoral retroversion. That are two other clinical conditions. If angle of torsion decrease, retroversion. If it is increasing, it is anteversion of the femur. Which of the following characteristics do not describe the illiofemoral ligament? So the question is, do not describe. You know, illiofemoral ligament is a capsular ligament. It is the strongest ligament. It is known as Y ligament of bigelow, and its function is prevention of or limits extension and external rotation. So the only possible wrong answer is limits extension and internal rotation. Extension and internal rotation is limited by the pubofemoral ligament. Remember, the pubofemoral ligament limits internal rotation. Illiofemoral ligaments limits external rotation. Next question, the area in the femoral neck where trabecular system is absent. That area is shown in the diagram. That area is known as the zone of weakness. And you have medial compressive trabecular system, you have the lateral tensile trabecular system, you have secondary compressive, lateral tensile and trochanteric system. Trabecular systems are always important. Just have a glance at the trabecular system and try to include in your studies about the trabecular system. So it is absent in that area is known as the zone of weakness. Chief trabecular system that resists compressive stress. The earlier diagram we did show that there is a trabecular system known as medial compressive trabecular system. So medial systems are actually preventing against the compression. Lateral systems are against the tensile force. If you have more doubts, just refer to my videos. There is a detailed description about the trabecular system of femur in the most advanced and simplified manner. Identify the correct closed back position of hip. This is always important question. The closed back position of hip is extension, slight abduction and medial rotation. That is the closed back position of a hip joint, because this close back position all the ligaments and all soft tissue gets taut to its maximum. The diagram shows the tautness of all the ligaments and all the soft tissue. So remember that is the extension, slight abduction and medial rotation is the close back position of hip complex. What is center edge angle? The angle formed between vertical line through the head of the femur and line connecting head to the margin of acetabulum. That is actually the center edge angle, because it helps in understanding or finding out acetabular dysplasia, acetabular protrusion, etc. So it is an angle between a vertical line through the head of the femur and connecting head to the margin. Just see the diagram, it is very clear. See a line drawn from a vertical line to the head of the femur, and a line connecting a vertical line and a line connecting head to the rim of the acetabulum or rim or margin of the acetabulum. See that line, that is center edge angle. It is 35 degrees shown. When anteversion it decreases and in retroversion it increases. So it is a line connecting head of the femur, vertical line from head of the femur to another line drawn from head to the margin of acetabulum is known as a center edge angle. Large bending moments in the neck of the femur are sustained by, that bending moments are sustained by your trabecular system. Trabecular system, one of the major role is to prevent the stress as well as the bending moment and other strain that the joint faces. To adapt to that stresses, actually we have a developed system in the hip joint, and that developed system is known as the trabecular system. You have, if you have doubt, please refer to my video. The stability of the hip complex is provided by what structures? Actually, you might feel to answer bones, bone surface, strong ligaments and muscles. But for your astonishment, this is that the muscles do not have stability, role of stability in erect stance or in equilibrium. In active phase it has, but in other time there is no role of muscles, only by the bony surface and strong ligaments. Ligaments are anterosuperior, they are strong, so they provides the stability. Identify correct orientation of acetabular orientation or acetabular opening. This is very important, and the answer is anteverted. Acetabulum is anteverted or anteriorly tilted 20 degree and inferiorly oriented 50 degree. Always you have to remember the acetabulum is anteriorly tilted 20 degree and inferiorly oriented about 50 degree. This should not be forgotten. So let's note down that. And the condition in which acetabulum is abnormally shallow and result in the lack of coverage of the femoral head, that condition is known as acetabular dysplasia. So acetabular dysplasia is a condition in which acetabulum is abnormally shallow and result in the lack of coverage of the femoral head. See the diagram, see the x-ray in left side, you can see that acetabulum is shallow and femoral head is actually outside the cavity. So that shows the condition known as acetabular dysplasia. If you have time, you study other conditions like acetabular protrusion, etc. That is also important. Last question, identify the position in which capsuloligamentous tension is least at the hip joint. That position is the position of comfort. If you have a pain in hip joint, we feel to keep it in that position. That position is mid-range flexion of the hip and slight abduction and mid-rotation. That is a position of maximum comfort. There, the synovial fluid, etc. can occupy maximum space inside the hip joint. So that is a position of comfort of the hip joint. And with that, we wind up. Thank you for your patience and attempting these questions. In next video, we will have module 2 of the hip complex, by which we will try to cover the hip complex completely. Stay tuned. If you haven't subscribed to my channel, kindly subscribe. We have here the competitive exam modules. We have a biomechanics discussion, anatomy discussion, and soon by next few days we will start the clinical test and the clinical scenarios, conditions we will be discussing. Thank you so much once again, and please subscribe to my channel, and if you like this video, please hit the like button, and if you have any comments or suggestions like how to change this, how to add on some modules, etc., please do mention in the comment box. I would be most happy to